Surrounds the opening between the upper and lower lids the palpebral aperture. Orbicularis oculi has an inner or palpebral part and an outer or orbital part. The palpebral part is extremely thin. The orbital part is more substantial. Orbicularis oculi arises medially from this underlying structure, the medial palpebral ligament, and from the bone above and below it. Its fibers pass above and below the palpebral aperture, joining with each other here. When the palpebral part of the muscle contracts, the eyelids close gently. When the whole muscle contracts, they close tightly. Opening the eye is caused by elastic forces acting on the lower lid and by a more deeply placed levator muscle acting on the upper lid that we'll see later in this tape. Now we'll move down to look at the muscles around the mouth and the nose. The opening between the lips, the oral commissure, is surrounded by the orbicularis oris muscle. Here's part of it. The orbicularis is joined and overlaid by several other facial muscles, which we'll remove from the picture for a moment. Here's the orbicularis oris by itself. Its more superficial fibers encircle the oral commissure, some of them arising from bone here. Its deeper fibers are continuous with those of the buccinator muscle, as we saw in the previous tape. The action of orbicularis oris is to close the oral commissure and press the lips together. The deep hollow here between the buccinator and masseter muscles is filled with this buccal fat pad, which is continuous with the fat that covers the front of the cheek. Now we'll return to the picture all except one of the muscles that pull on the orbicularis oris. Pulling on it from above and behind is the zygomaticus major, which arises from here on the zygomatic bone. Pulling on it from behind is the risorius muscle. We use both these muscles when we smile. Pulling on the orbicularis from above are zygomaticus minor, absent in this instance, levator anguli oris, and levator labii superioris. These arise from here on the maxilla. Together, they raise the upper lip. The most medial corner of levator labii superioris, which goes by this very impressive name, attaches to the alar cartilage of the nose. It does this. Here on the side of the nose is the nasalis muscle. It helps to wrinkle the nose. The three muscles that join the orbicularis from below are quite hard to tell apart. They're depressor anguli oris, depressor labii inferioris, and mentalis. The last two run into one another and are embedded in this mass of fat and fibrous tissue which forms the prominence of the chin. These three muscles arise from here on the mandible. Between them they pull the lower lip downward and pucker the chin. The last muscle we'll add to the picture, the platysma, lies partly in the face but mainly in the neck. Here's the neck as we saw it in the last tape, without the platysma. Here are the sternocleidomastoid muscle, the infrahyoid muscles, and the digastric muscle. Now we'll add the platysma to the picture. All this is platysma. It lies within the subcutaneous fascia of the neck. Its lowest fibers extend below the clavicle, onto the chest. Platysma has a free posterior border here, and a free anterior border here, near the midline. Most of the fibers of platysma insert here along the border of the mandible, but its more posterior fibers cross the mandible and insert into the orbicularis oris complex. The platysma pulls the corner of the mouth downwards and backwards, producing these ridges beneath the skin. Now we'll move on to look at the scalp. To understand the scalp, we'll start with a dissection in which all its layers have been removed, exposing the skull. The dome of the skull, known as the calvaria, is formed by bones that we've seen in the previous tape. The frontal, parietal, and occipital bones, and on the side by the squamous part of the temporal bone. The temporal bone is covered by the investing deep fascia of the temporalis muscle. Overlying the calvarium is a layer of loose connective tissue, the areolar layer. It overlies the deep temporal fascia too. The areolar layer separates the bone from the next layer that we'll add, the assembly of structures known collectively as the epicranium. The epicranium is formed partly by tendon, partly by muscle. To see it better, we'll add all of it to the picture. Over the dome of the skull, the epicranium is formed by a sheet of tendon that's known as the galea, or galea aponeurotica. Two muscles are attached to the galea. In front, the frontalis, and behind, the occipitalis. The occipitalis muscle arises from here on the occipital bone, above the superior nuchal line. It inserts into the galea. The frontalis muscle arises from the galea and inserts into the skin of the lower part of the forehead, close to the eyebrow. These two muscles produce important movements of facial expression. When occipitalis and frontalis act together, the eyebrows rise. When frontalis acts by itself, the forehead is pulled downward in a frown. The full effect of a frown comes from the added effect of these not very separate muscles, depressor supercilii and procerus, and by the more deeply placed corrugator supercilii, which pulls the eyebrow medially, causing these vertical wrinkles. On the side of the head, the epicranium is formed by this area of dense connective tissue, the superficial temporal fascia. In some individuals, as in this different specimen, the epicranium includes the vestigial auricularis muscles, which can move the external ear. Now we'll add the more superficial part of the scalp to the picture. Firmly attached to the epicranium is a layer of fibrous tissue interlaced with fat. Above this is the hair-bearing skin of the scalp. These are the hair follicles, which extend through the thickness of the skin. That brings us to the end of this brief section. Now, let's review what we've seen of the facial muscles and the scalp. Here's the orbicularis oculi, its palpebral part, and its orbital part. Here's orbicularis oris. Here are the risorius, zygomaticus major, levator anguli oris, levator labii superioris, and nasalis muscles. Here are the depressor anguli oris, depressor labii inferioris, and mentalis. And here's platysma. Here's the areolar layer of the scalp. Here's the epicranium, consisting of the galea, the frontalis and occipitalis muscles, and the superficial temporal fascia. Here are the procerus, the depressor, and the corrugator supercilii. That brings us to the end of this section on the facial muscles and the scalp. In the next section, we'll move on to look at the brain. In this section, we'll first take a brief look at the shape of the brain and its main parts. Then we'll look at the cavity that contains it and the layers of tissue that surround it. Then we'll return to the brain itself and look at it in more detail. Here's the brain. Much the largest part of the brain is the cerebrum. The cerebrum is partly divided in the midline into two cerebral hemispheres. Below the cerebrum, and separate from it, is the smaller cerebellum. The cerebrum and the cerebellum both grow out of the brainstem. The brainstem becomes continuous below with the spinal cord. The brain is contained within the cranial cavity. Here's the cranial cavity in a dry skull. It's almost the same shape as the brain. As we saw in the last tape, two big steps divide the floor of the cavity into three parts. The sphenoid ridges separate the anterior cranial fossa from the middle cranial fossa. This part of the cerebrum, the frontal lobe, occupies the anterior cranial fossa. This part, the temporal lobe, occupies the middle cranial fossa. The petrous temporal bones separate the middle cranial fossa from the posterior cranial fossa. The posterior cranial fossa contains the cerebellum and the brainstem. Here's the foramen magnum. Now let's see how the cranial cavity looks in the living body. The cranial cavity is lined throughout by this layer of tough, shiny fibrous tissue, the dura. Below, the layer of dura passes through the foramen magnum, becoming continuous with the dura that lines the vertebral canal. Two important extensions of the dura create partitions within the cranial cavity. They're the falx and the tentorium. Here's the tentorium. Its full name is tentorium cerebelli. It separates the posterior cranial fossa from the rest of the cranial cavity and separates two major parts of the brain, the cerebrum above from the cerebellum below. This opening in the tentorium is called the tentorial incisure. The brainstem passes through it. The tentorium is attached along this line on the occipital bone and along the edge of the petrous temporal bone. Its attachment ends at the posterior clinoid process. The upper surface of the tentorium is continuous with the dura of the floor of the middle cranial fossa. In the midline, the tentorium is attached to the other major partition, the falx, which we'll add to the picture. This is the falx. Its full name is falx cerebri. The falx forms a midline partition between the two cerebral hemispheres. Here's its attachment to the tentorium. Along its length, it's attached to the occipital, parietal, and frontal bones. Here in front, the falx is attached to the crista galli. To see the falx in cross-section, we'll divide it along this line. Near its attachment, the falx splits into two layers, leaving a triangular space for the superior sagittal sinus, an important part of the brain's venous drainage system, as we'll see later in this tape. Now we'll move on to look at the layers of tissue that give the brain a protective covering and maintain its special fluid environment. These three layers, the dura, the arachnoid, and the pia, are collectively called the meninges. We've already taken an inside look at the outer layer, the dura. To see the two inner layers, the pia and the arachnoid, we need to add the brain itself to the picture. We're looking at the right cerebral hemisphere. The blood vessels on its surface have been filled with red latex. The surface of the brain is richly folded. An outward fold is called a gyrus, an inward fold is a sulcus. The pia is almost invisibly thin. It's just the glossy surface that we see here. To see the extent of the pia, we'll look at a frontal section. Here's a typical sulcus. The pia extends down into each sulcus and back up onto the next gyrus. Each sulcus contains blood vessels which lie just outside the pia. Each vessel that enters the brain carries a sleeve of pia with it. Now we'll add the arachnoid to the picture. This is the arachnoid. It's a delicate, transparent membrane. Here's the arachnoid again. Unlike the pia, the arachnoid doesn't extend into the sulci. It bridges over from one gyrus to the next. In this specimen, the subarachnoid space is empty. Here, we're injecting water to fill it. Over most of the brain, the subarachnoid space is narrow, but in a few places it's quite wide. notably here below the cerebellum, here above the cerebellum, and here in front of the top of the brainstem. These spaces are called cisterns. Outside the arachnoid is the dura. We'll add it to the picture. The dura is a much tougher layer of tissue than either the pia or the arachnoid. The dura has almost no attachment to the arachnoid. The dura can be separated from the overlying bone, but is normally quite closely attached to it. Now we'll add the rest of the dura to the picture. Here's the intact dura. These are branches of the middle meningeal artery, which runs in the thickness of the dura. To look at the openings in the dura, we'll again look at it from the inside in an empty skull. The vessels and nerves that enter and leave the cranial cavity pass through openings in the dura. At each opening, the dura forms a tunnel around the nerve or vessel for a short distance. Typically, a nerve or blood vessel runs beneath the dura for a distance between its opening in the dura and its opening in the bone. So the openings in the dura often don't match the openings in the bone. The difference between dural and bony openings is specially marked here in the middle cranial fossa. As we saw in the previous tape, the bone here has many openings. By contrast, the dura here has no openings. The corresponding openings in the dura are either up here or back here. As we'll see in later sections, the central part of the middle cranial fossa is a especially busy area. Let's take a further look at it. In the dry skull, this hollow, the pituitary fossa, is partly enclosed by these four bony projections, the clinoid processes. In the living body, the dura bridges over the roof of the pituitary fossa, leaving this round opening. The clinoid processes are here. The pituitary fossa, which contains the pituitary gland, is lined with dura. Just lateral to the pituitary fossa is the cavernous sinus, which is hidden beneath the dura here. This opening in the dura, which is for the trigeminal nerve, leads into a side cavity under here, the trigeminal cave, which is occupied by the trigeminal ganglion. We'll see more of this busy area later in this tape when we look at the vessels and nerves. Now, we're almost ready to move on to look at the brain. Before we do that, let's review what we've seen of the cranial cavity and the meninges. Here are the sphenoid ridges and the petrous temporal bones, the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Here's the dura on the outside and on the inside. Here are the falx, the tentorium, and the tentorial incisure. Here's the arachnoid. Here's the pia. Here are the cisterns. Here are the clinoid processes and the pituitary fossa in the dry skull. Here are the same structures in a dissected specimen. Here's the site of the cavernous sinus and of the trigeminal cave. Now we'll move on to look at the brain. The internal structure of the brain, which is extremely complex, lies outside the scope of this atlas. In this section, we'll look at the main external features of the brain and also at the cavities within it, the ventricles. This model shows the shape of the ventricular system. It's formed by two small cavities in the midline, the third ventricle and the fourth ventricle, and two much larger cavities, the lateral ventricles, which connect to the third ventricle here. It's the third ventricle because the lateral ventricles are counted as the first two. The ventricles are filled with cerebrospinal fluid. We'll see more of them as we go along. To understand the external features of the brain, we'll start with the central stalk, which is known as the brainstem. To look at it, we'll take the rest of the brain out of the picture. Here's the brainstem. It consists of the medulla, the pons, and the midbrain. The brainstem contains tracts that connect the cerebrum, the cerebellum, and the spinal cord. And it contains nuclei that serve basic autonomic functions. It's also the origin of nearly all the cranial nerves. The medulla is cone-shaped. It tapers down to become continuous with the spinal cord. The medulla becomes continuous with the spinal cord here at the foramen magnum. The medulla, the pons, and the midbrain are located just behind the basilar part of the occipital bone and the dorsum celli. The dorsal aspect of the medulla faces almost directly backwards. The back of the upper part of the medulla forms the floor of the fourth ventricle. On the model, this is the fourth ventricle, this is the floor. This arch of tissue is the superior medullary velum, which forms the roof of this part of the ventricle. This delicate tissue, the inferior medullary velum, forms this part of the roof. This cut surface is the attachment of the cerebellum. It's described as consisting of the superior, middle, and inferior cerebellar peduncles, which are somewhat fused together. The ventral aspect of the medulla is marked on each side by these bulges, the pyramid and the olive. Emerging from the ventral and lateral surfaces of the medulla are the filaments of the four lowest cranial nerves, the 12th, the hypoglossal, the cranial part of the 11th, the accessory, the 10th, the vagus, and the 9th, the glossopharyngeal. Here's the brainstem in situ, seen from behind. The tentorium has been removed to give us this view. Here's the cerebellum, divided in the midline. Here's the divided cerebellar peduncle. Here are the filaments of the hypoglossal nerve, making their exit from the cranium. Here are the accessory, vagus, and glossopharyngeal nerves, making their exit together through one opening. Above the medulla is the pons. On each side, the pons becomes continuous with the middle cerebellar peduncle. Arising from the groove between the pons and the medulla are the next three cranial nerves. They're the 8th, the vestibulocochlear, the 7th, the facial, and the 6th, just visible, the abducent. The 5th cranial nerve, the trigeminal, emerges from the upper part of the pons. Here's the middle cranial fossa. Here's the petrous temporal bone. Here's the pons. Here are the facial and vestibulocochlear nerves together. Here's the trigeminal nerve. Here's the abducent nerve. The part of the brainstem above the pons is the midbrain. Features of its dorsal surface are the upper part of the roof of the fourth ventricle, the superior cerebellar peduncles, these bulges, the inferior and superior colliculi, and, in the midline, the pineal body. The fourth cranial nerve, the trochlear, emerges from the dorsum of the midbrain. The midbrain spreads out into these two massive columns, the cerebral peduncles, which connect the brainstem to the cerebrum. Here are the cerebral peduncles in the intact brain. They're largely hidden by the lower parts of the cerebral hemispheres, the temporal lobes. To see the cerebral peduncles better, we'll look at a brain in which the temporal lobe and the cerebellum have been removed. Here are the cerebral peduncles again. Here on the outside of the cerebral peduncle are the medial geniculate body and the lateral geniculate body, which gives rise to the optic tract. Between the cerebral peduncles, the third cranial nerve, the oculomotor, emerges. We'll return to the intact brain. Here are the two oculomotor nerves. Here are the two optic tracts. They meet at the optic chiasm. From the optic chiasm, the two optic nerves emerge. They're the second cranial nerves. Here's the brain in situ, with the right cerebral hemisphere removed. Here's the corpus callosum, which joins the two cerebral hemispheres. Here's the divided cerebral peduncle. Here's the midbrain. Here's the floor of the middle cranial fossa. Here's the optic nerve running forwards beneath the dura toward the optic canal. Here's the oculomotor nerve. Here's the trochlear nerve. The ventral aspect of the brain passes upwards to here, then turns a corner and continues forwards into a complicated area that we'll look at later in this section. Now that we've looked at the brain stem, we'll move on to look at the cerebellum. Here are the brainstem and the cerebellum together. The main functions of the cerebellum have to do with balance, motor coordination, and the control and monitoring of intentional movements. The cerebellum occupies most of the posterior cranial fossa. The tentorium is just above it. To see the cerebellum better, we'll look at it by itself. The surface of the cerebellum is marked by many parallel fissures, some deeper than others. This deep primary fissure divides the cerebellum into a small anterior lobe and a large posterior lobe. A deep groove on the underside partially divides the cerebellum into two hemispheres. These are joined by this midline mass, the vermis, which extends all the way round from the top to the underside. Here are the divided cerebellar peduncles, the superior one from the midbrain, the inferior one from the medulla, and the middle one. As we've seen, the middle cerebellar peduncle becomes continuous with the pons. This cavity in the anterior aspect of the cerebellum is the most posterior part of the roof of the fourth ventricle. That's this part in the model. Now we'll move on to look at the cerebrum. Here's the cerebrum with the brainstem attached and the cerebellum removed. The functions of the cerebrum include the senses of vision, hearing, smell, touch, and spatial perception, and also speech and language, memory, thought, and voluntary action. The cerebrum is formed mainly by the two cerebral hemispheres. These are separated in the midline by the falx, which occupies this longitudinal cerebral fissure. Though they look hemispherical from in front, the shape of each cerebral hemisphere is more complex when seen from the side. In front, this part, the frontal lobe, occupies the anterior cranial fossa. This part below, the temporal lobe, occupies the middle cranial fossa. This part behind, the occipital lobe, lies above the tentorium. The two cerebral hemispheres are connected across the midline by the corpus callosum, which runs all the way from here in front to here behind. The two cerebral hemispheres are connected below by the two cerebral peduncles, converging on the brainstem. They're also connected by the structures of this area, the floor of the third ventricle. To see these connecting structures better, we'll look at a brain that's been divided in the midline. Here's the corpus callosum. This is the cerebral peduncle. The third ventricle is here. Here's the third ventricle in the model. It's quite narrow from side to side. This is the floor of the third ventricle. The surface of each cerebral hemisphere is richly folded. Each inward fold, or sulcus, and each outward fold, or gyrus, has a name. But here we'll name only two, the central and the lateral sulci. This is the lateral sulcus. It's very deep. It extends all the way round to here on the underside. Here's the medial end of the lateral sulcus in the intact brain. The lateral sulcus separates the frontal lobe above from the temporal lobe below. This long sulcus running upwards and backwards is the central sulcus. It's the only one that runs all the way to the medial surface of the hemisphere. The cerebral hemisphere is described as consisting of 4 lobes: the frontal, temporal, and occipital lobes that we've mentioned already, and the parietal lobe. Between the frontal lobe and its neighbours, the central and lateral sulci form natural boundaries. The other boundaries are somewhat arbitrary. Here are the 4 lobes on the medial surface: frontal, parietal, occipital, and temporal. The sloping underside of the occipital lobe conforms to the upward slope of the tentorium. Here are the 2 temporal lobes, seen from below. This part of the tip of the temporal lobe is the uncus. The uncus lies just above the tentorial incisure, which is here. Here on the underside of the frontal lobe is the olfactory tract. It ends in the olfactory bulb, from which the fibers of the first cranial nerve, the olfactory nerve, emerge. Each cerebral hemisphere contains a cavity, the lateral ventricle, that's filled with cerebrospinal fluid. The lateral ventricle has an anterior horn, a body, a posterior horn, and an inferior horn. The anterior horn is in the frontal lobe, the body is in the parietal lobe, the posterior horn is in the occipital lobe, and the inferior horn curls downward and forward into the temporal lobe. To see where the lateral ventricle communicates with the third ventricle, we'll go round to a medial view. The communication is here, at the interventricular foramen. To see how the lateral ventricle, the third ventricle, and the fourth ventricle are connected, we'll look at a brain that's been divided in the midline. Here's a midline section through the third ventricle. Here's the third ventricle. This strand of vascular tissue in the roof of the ventricle is the choroid plexus, which produces cerebrospinal fluid. Here's the interventricular foramen opening into the lateral ventricle. The choroid plexus passes through the foramen and continues into the lateral ventricle. The cerebrospinal fluid that's formed in the lateral and third ventricles passes through this narrow passage, the cerebral aqueduct, and into the fourth ventricle. Fluid leaves the fourth ventricle through 3 openings: the lateral apertures, the right one is in the depths of this recess, and the medial aperture, which is in the midline, here. It's easier to visualize the medial opening in this dissection. Here it is, in the inferior medullary velum. The lateral openings are here. The medial opening comes out here, between the cerebellum and the medulla. The lateral opening on each side comes out just below the cerebellar peduncles. These openings lead to the subarachnoid space surrounding the brain and spinal cord. We'll see where the cerebrospinal fluid is absorbed later in this tape when we look at the blood vessels. We'll return now to the underside of the cerebrum to look at the structures that form the floor of the third ventricle, which is here. Here's the optic chiasm. Behind it, this tubular structure that's been divided is the infundibulum, the stalk of the pituitary gland. These two projections are the mammillary bodies. To see how the pituitary gland is attached to the brain, we'll look at an intact specimen divided in the midline. Here's the floor of the third ventricle, here's the optic chiasm, here's the infundibulum, leading down to the pituitary gland or hypophysis. The anterior and posterior parts of the pituitary gland are quite distinct. The pituitary gland sits in the pituitary fossa. The pituitary fossa bulges downwards into the roof of the sphenoid sinus. This area just above the pituitary stalk is the hypothalamus. In the dissections we've seen so far, including this one, the picture has been simplified by removing the important arteries that surround the base of the brain and run in the major sulci. We'll see these later in this tape. Now let's review what we've seen of the brain. Here's the cerebrum, the cerebellum, and the brainstem. Here are the medulla, the pons, and the midbrain. Here's the superior medullary velum, the floor of the fourth ventricle, and the inferior medullary velum. Here are the cerebellar peduncles, superior, middle, and inferior. Here are the pyramid and the olive. Here are the filaments of the hypoglossal, the cranial part of the accessory, the vagus, and the glossopharyngeal nerves. The vestibulocochlear and facial nerves, the abducent nerve, and the trochlear nerve. Here are the colliculi, inferior and superior, and the pineal body. Here's the medial geniculate body, the lateral geniculate body, and the optic tract. On the cerebellum, here's the primary fissure, the anterior and posterior lobes, the vermis, and the roof of the fourth ventricle. Here are the cerebral hemispheres. Here's the corpus callosum. Here are the frontal, parietal, occipital, and temporal lobes. Here are the oculomotor nerve, the optic chiasm, the optic nerves, the infundibulum, and the mammillary bodies. In the model, here are the lateral ventricles, the third ventricle, and the fourth ventricle. Here's the third ventricle, the interventricular foramen, the choroid plexus, the cerebral aqueduct, and the fourth ventricle. Here's the hypothalamus, here's the infundibulum, and the pituitary gland. That brings us to the end of this section on the brain. In the next section, we'll look at the cranial nerves. In this section, we'll look at the 12 cranial nerves, the sympathetic trunk, and the cervical nerves. The cranial nerves are numbered by the order in which they leave the cranial cavity. Earlier in this tape, we saw them emerging from the brain. In this section, we'll follow the course of each nerve, look at its principal branches, and summarize its functions. We'll begin with the first 6 cranial nerves. The first, the olfactory, and the second, the optic, transmit our senses of smell and of eyesight. The third, the oculomotor, the fourth, the trochlear, and the sixth, the abducent, are motor nerves to the eye muscles. And the fifth, the trigeminal, is a large motor and sensory nerve to the face and jaws. The first cranial nerve, the olfactory nerve, is extremely short. It consists of a series of fine filaments which arise from the olfactory bulb on the underside of the frontal lobe. On each side, the olfactory bulb lies here, just above the cribriform plate. Here's a frontal section in the dry skull that goes through the cribriform plates. They're here. On each side, the cribriform plate forms the narrow roof of the nasal cavity. Here's a medial view of the nasal cavity. The cribriform plate is here. The filaments of the olfactory nerve, here they are in close-up, pass through the cribriform plate and run just beneath the mucous membrane to reach nerve endings in this olfactory area on the lateral and medial surfaces of the nasal cavity. The next nerve we'll look at is the second cranial nerve, the optic nerve. We've seen the proximal ends of the optic nerves emerging from the optic chiasm. Here's the optic nerve passing forward beneath the dura to enter the optic canal, which starts here. Here's the optic canal in the dry skull. Here on each side of the optic chiasm are the divided internal carotid arteries. Just beneath the chiasm is the roof of the pituitary fossa. Here's the divided stalk of the pituitary gland. To follow the optic nerve, we'll remove the roof of the orbit, leaving the optic canal intact. We'll remove this nerve and the orbital fat, and these two muscles, which we'll see later. Here's the optic nerve. It enters the orbit between the tendons of origin of the rectus muscles. It passes forwards and laterally to enter the back of the eyeball. Strictly speaking, the optic nerve isn't a nerve, it's an extension of the brain. It's covered throughout its course by extensions of all three meningeal layers, dura, arachnoid, and pia. Here we've made a window in the dura surrounding the optic nerve. Here's the edge of the dura. Here's the nerve itself. Here's the arachnoid. The dura is continuous with the outer layer of the eyeball, the sclera. We'll be returning here shortly. For now, we'll put the contents of the orbit back in place. The optic chiasm is a crossover point for optic nerve fibers. The fibers of each nerve that connect to the medial half of the retina cross over into the opposite optic tract. The fibers that connect to the lateral halves of the retinae stay on the same side. Now we'll move on to look at the third, fourth, and sixth cranial nerves, the oculomotor, trochlear, and abducent. They're motor nerves. Between them, they supply the 6 muscles that move the eye and also the levator of the upper lid. As we've seen, the oculomotor nerve arises between the cerebral peduncles, the trochlear nerve arises from the back of the midbrain, and the abducent nerve arises below the pons. The bony opening that these 3 nerves pass through is the superior orbital fissure, but their openings in the dura are quite a bit further back. The oculomotor nerve passes through the dura just alongside the posterior clinoid process, which is here. The trochlear nerve passes through the dura here. The abducent nerve down here. To follow them, we'll remove the dura over this area. We'll also remove this structure that we'll see later, the trigeminal ganglion. This cavity that we've opened into is the cavernous sinus. In the living body, it's filled with venous blood. Within the cavernous sinus lies the internal carotid artery. The 3rd, 4th, and 6th nerves pass forward in the lateral wall of the cavernous sinus. Here's the oculomotor, here's the trochlear, here's the abducent. All 3 nerves pass forward into the orbit through the superior orbital fissure, which is here. The 7 muscles in the orbit that these nerves supply are the 4 rectus muscles, the 2 oblique muscles, and the levator of the upper lid. The oculomotor nerve supplies 5 muscles. The trochlear and abducent nerves supply just 1 muscle each. To follow these nerves, we'll move forward to the orbit again. We'll divide and displace the 2 muscles in the roof of the orbit. These are the levator of the upper eyelid, levator palpebris superioris, and beneath it, the superior rectus muscle. Here's the optic nerve, as we've seen already. Here's the superior oblique muscle going round its pulley or trochlea. Here are the medial rectus and lateral rectus muscles. We'll go round to a front view to see the nerves better. The oculomotor nerve divides into an upper and lower branch. Here's the upper branch supplying the levator palpebris superioris and superior rectus muscles. To see the lower branch, we'll remove the optic nerve. Here again are the medial and lateral rectus muscles. Down here is the inferior rectus. The only muscle not on view here is the inferior oblique, which is beneath the eyeball here. Here's the lower branch of the oculomotor nerve. It supplies the medial rectus and inferior rectus and the inferior oblique muscles. In addition, by these tiny, short ciliary branches, the oculomotor nerve gives parasympathetic motor supply to muscles within the eye which cause constriction of the pupil, the sphincter pupillae and ciliary muscles. Here's the trochlear nerve, the 4th cranial nerve. It supplies just the superior oblique muscle. Here's the abducent nerve, the 6th, supplying its 1 muscle, the lateral rectus, which abducts the eye. We'll be returning to the orbit once again in just a minute to look at branches of the 5th nerve, the trigeminal. For now, we'll replace the contents of the orbit, including this nerve, the frontal nerve, which is part of what we'll come to next. Now we'll move on to look at the 5th cranial nerve, the trigeminal. It's the largest of the cranial nerves and by far the most complex. It's named from the fact that it has 3 major branches, the ophthalmic, the maxillary, and the mandibular. The main functions of the trigeminal nerve are to provide sensation to the face, the nasal cavity, and the oral cavity, and to provide motor supply to the muscles of mastication. As we saw in the last section, the trigeminal nerve emerges from the pons and passes forwards. To follow it, we'll go to an earlier stage of the dissection that we've been looking at. The trigeminal nerve passes forwards from the pons into a tunnel in the dura. The tunnel leads into a side cavity, the trigeminal cave, which we'll expose by removing the overlying dura. Here's the trunk of the nerve. Here are its 3 branches, the ophthalmic, the maxillary, and the mandibular. All the sensory fibers of the trigeminal nerve synapse in this massive ganglion, the trigeminal ganglion. In relation to the dry bone, the trigeminal ganglion is here. The openings for the 3 branches are the superior orbital fissure for the ophthalmic, the foramen rotundum for the maxillary, and the foramen ovale for the mandibular. The first branch of the trigeminal, the ophthalmic nerve, passes forwards through the superior orbital fissure. As it passes through the fissure, it divides. It gives off the frontal nerve, which runs just beneath the roof of the orbit, and divides into cutaneous branches which go to the forehead. In addition, the ophthalmic nerve gives rise to the lacrimal nerve, which supplies the lacrimal gland, and the nasociliary nerve, which gives off 1 or more ethmoidal nerves and a cutaneous branch, the infratrochlear nerve. Through two long ciliary nerves, here's one of them, the nasociliary nerve provides sensation to the eyeball. The branches of the frontal nerve that we saw emerge onto the face around the orbital margin or through openings in it. The branches of the frontal nerve are the supraorbital, the supratrochlear, and the infratrochlear. These supply the forehead, the upper eyelid, and the upper part of the nose. The ethmoid branches of the nasociliary nerve supply this part of the lining of the nasal cavity. Now we'll move on to look at the second and third divisions of the trigeminal, the maxillary and mandibular nerves. Before we look at these two nerves, which are both quite complex, we'll spend a minute reviewing the region into which they emerge. It's a little complex too. To see it, we'll first look at a dry skull in which the zygomatic arch has been removed. Here's the area we'll be looking at. Here's the underside of the greater wing of the sphenoid bone. Here's the lateral pterygoid plate. Here's the back of the maxilla. This gap between the pterygoid process and the maxilla is the pterygomaxillary fissure. It's continuous with this gap between the maxilla and the greater wing of the sphenoid, the inferior orbital fissure. Here's the inferior orbital fissure seen from in front. The maxillary nerve emerges here, deep in the pterygomaxillary fissure. The mandibular nerve emerges here, behind the lateral pterygoid plate. To get to this remote area in a dissected specimen, we have to remove several major structures. First, the masseter muscle, then the deep temporal fascia, then the zygomatic arch, and then the temporalis muscle, and the ramus and coronoid process of the mandible, and finally this muscle, the lateral pterygoid, together with the condyle of the mandible. This brings us into the infratemporal fossa. Before we look at the nerves, let's get oriented. Here's the underside of the greater wing of the sphenoid. Here's the lateral pterygoid plate, the back of the maxilla, the pterygomaxillary fissure, and the superior orbital fissure. This is the medial pterygoid muscle. It slopes downwards and outwards towards its insertion on the medial aspect of the mandible. This muscle is the buccinator. Now that we're oriented, let's look at the maxillary nerve. As we've seen, the maxillary nerve runs forwards from the trigeminal ganglion and enters the foramen rotundum, which is here. Here's the foramen rotundum in the dry bone. We'll go round to the outside to see where it emerges. Here it is, well hidden in the pterygomaxillary fissure. The foramen rotundum goes out of sight as we go round to a lateral view of the pterygomaxillary fissure. Now, we'll return to the dissection. Here's the maxillary nerve running forwards across the pterygomaxillary fissure. As it approaches the maxilla, it divides into branches. The continuing trunk of the nerve is known as the infraorbital nerve. We'll follow it first. The infraorbital nerve runs forward into a bony tunnel in the floor of the orbit. It emerges again here at the infraorbital foramen. The infraorbital nerve divides into palpebral, nasal, and labial branches. These supply the lower eyelid, part of the nose and cheek, and the upper lip. The branches of the maxillary nerve supply the upper teeth, the nasal cavity and palate, and the upper part of the cheek. Most of them run through tunnels in the bone. Because of this, and because they're small, they're hard to show in a dissection. To indicate where they run, we'll add lines to the picture. The upper teeth are supplied by the superior alveolar nerves. posterior and anterior, which together form a loop. The posterior superior alveolar nerves, in this case there are two, branch off behind the maxilla and run down to enter tunnels in the maxilla here. The anterior superior alveolar nerve arises from the infraorbital nerve within its tunnel and runs downward and forwards within the bone. The superior alveolar nerves, anterior and posterior, form a loop within the maxilla. From this loop, dental and gingival branches arise that supply the upper teeth and the upper gums. The maxillary nerve also gives off palatine and nasopalatine branches that supply the palate and parts of the nasal cavity. To see where these go, we'll look at a skull that's been divided in the midline. The opening that's illuminated is the sphenopalatine foramen, which opens into the pterygomaxillary fissure. The maxillary nerve enters the fissure from behind here. Two palatine nerves, the greater and lesser, arise from the maxillary nerve and run down through a bony tunnel that's been partly opened here. The palatine nerves emerge here through the palatine foramen. The palatine nerves provide sensation to the palate from here to here. In addition, the greater palatine nerve has nasal branches. Together with nasal branches from the trunk of the maxillary nerve, these supply this part of the lining of the nasal cavity. The nasopalatine nerve passes through the sphenopalatine foramen, round the front of the sphenoid sinus, and onto the nasal septum. The nasopalatine nerve supplies the nasal septum, then passes through the incisive foramen in the maxilla to supply the anterior part of the hard palate. Last of all, the maxillary nerve gives off a zygomatic branch. This divides into the zygomaticofacial and zygomaticotemporal nerves. These pass through the zygomatic bone, emerging here to supply this part of the cheek. Now we'll move on to look at the third division of the trigeminal, the mandibular nerve. Here's the mandibular nerve leaving the trigeminal ganglion. The mandibular nerve passes downward through the foramen ovale. The foramen ovale emerges under here. The foramen is just behind the root of the lateral pterygoid plate. Returning to the dissection, here's the mandibular nerve branching as it emerges from the foramen ovale. The mandibular nerve has both motor and sensory branches. Its motor branches, here they are, go to the muscles of mastication, masseter, temporalis, and the pterygoid muscles. Small branches not seen here supply tensor tympani and tensor palati. The other branches of the mandibular nerve are almost entirely sensory. This branch is the buccal nerve. It runs downward and forwards to supply sensation to the cheek, both outside and inside. This branch is the auriculotemporal nerve. It passes deep to the neck of the mandible, which is here, then runs upwards to supply sensation to this region on the side of the head. This leaves two major branches which run downward on the medial pterygoid muscle. They're the inferior alveolar nerve and, just in front of it, the lingual nerve. Seen from the inside, the lingual nerve is here, the inferior alveolar nerve is here. The insertion of the medial pterygoid muscle is here. The inferior alveolar nerve follows the medial pterygoid muscle down toward the mandible. It enters the mandible through this opening, the mandibular foramen. As it enters the bone, the inferior alveolar nerve lies just behind this projection, the lingula. To follow the course of the inferior alveolar nerve in the mandible, will remove the overlying bone. Here's the inferior alveolar nerve entering its tunnel in the bone, the mandibular canal. Just before it does so, it gives off this mylohyoid branch, which runs downwards in this groove to supply the mylohyoid muscle and the anterior belly of the digastric. Passing along the mandibular canal, the inferior alveolar nerve gives off branches that supply the lower teeth and gums. A large branch, the mental nerve, emerges through the mental foramen, which is here. The mental nerve supplies the chin and the lower lip. Now we'll look at the lingual nerve. To follow it, we'll first remove the inferior alveolar nerve and the buccinator muscle. This brings us into the oral cavity. The lingual nerve passes close to the mandible. To follow its course, we'll remove this part of the mandible. We'll also remove the mucosa from the side of the tongue and the floor of the mouth. Here's the lingual nerve. Now that we can see it all, we'll follow it from the top. Up here, the divided stump of the inferior alveolar nerve has been displaced forward so that we can see an important detail. Early in its course, the lingual nerve is joined by this nerve, the chorda tympani, which is a special branch of the facial nerve. The lingual nerve runs down toward the corner of the medial pterygoid muscle, passing just medial to the buttress of the mandible. The lingual nerve passes forwards along the base of the tongue, giving off branches along its length. The lingual nerve provides common sensation and also taste sensation to the anterior two-thirds of the tongue. The taste fibers that travel in the lingual nerve are carried by the chorda tympani. Now we've looked at the first 6 cranial nerves. Let's review what we've seen so far in this section. Here are the filaments of the first cranial nerve, the olfactory. Here's the second cranial nerve, the optic. Here's the third nerve, the oculomotor, its upper division and its lower division. Here's the fourth nerve, the trochlear, and here, out of order, is the sixth, the abducent. Here's the trigeminal nerve, the main trunk, the trigeminal ganglion, and the 3 divisions, the ophthalmic, the maxillary, and the mandibular. Here are the main branches of the ophthalmic, the frontal nerve, the nasociliary nerve, the lacrimal nerve. Here are the main branches of the maxillary, the infraorbital, the posterior and anterior superior alveolar, the palatine nerves, greater and lesser, the nasopalatine nerve, and the zygomaticofacial and zygomaticotemporal nerves. Here are the main branches of the mandibular nerve, the buccal nerve, the motor branches, the auriculotemporal nerve, the lingual nerve, and the inferior alveolar nerve. We'll move on now to look at cranial nerves 7 through 12. We'll begin with the 7th and 8th, the facial and vestibulocochlear nerves. As we've seen, these 2 nerves leave the brainstem just below the pons. Here's the facial, here's the vestibulocochlear. To follow them, we'll look at a dissection of the posterior cranial fossa, in which the cerebellum has been removed. Here's the back of the petrous temporal bone. Here are the facial and vestibulocochlear nerves. This is the vestibulocochlear nerve. This is the facial nerve. Together they pass through this opening, the internal auditory meatus. Here's the internal auditory meatus in the dry skull. It's a short tunnel with 3 openings. The facial nerve passes forwards through this one to enter its own bony tunnel, the facial canal. In the facial canal, The facial nerve has a complex course in the temporal bone, passing round the wall of the tympanic cavity and coming out behind the styloid process here. To get a view of its course, we've removed the front wall of the external auditory meatus along this line. We've also unroofed a small part of the petrous temporal bone here. To represent the facial nerve, we'll add this green wire to the picture. Entering its canal, the facial nerve passes forwards briefly, then makes an abrupt U-turn called the genu and passes backward. To follow it, we'll come round to the outside and look into the tympanic cavity. The facial nerve passes backwards high in the medial wall of the tympanic cavity above the oval window. It then turns downwards to emerge here at the stylomastoid foramen, just behind the root of the styloid process. On its way through the temporal bone, the facial nerve gives off three branches: the greater petrosal nerve, which is an autonomic branch, a branch in the middle ear to the stapedius muscle, and a special branch, the chorda tympani, represented by this wire. The chorda tympani passes upwards on the inside of the tympanic membrane and leaves the cranium here to join the lingual nerve. We've seen already that the chorda tympani transmits taste sensation from the anterior two-thirds of the tongue. Now we'll follow the trunk of the facial nerve. As we saw in the previous tape, the facial nerve passes through the parotid gland. In the dissection we'll look at now, the parotid gland has been completely removed. Here's the external auditory meatus, the sternocleidomastoid muscle, and the posterior belly of the digastric. Here's the styloid process. Here's the trunk of the facial nerve emerging from the stylomastoid foramen here. Now we'll add its branches to the picture. Between them, they supply all the muscles of facial expression. These temporal branches supply the frontalis muscle. These orbital branches supply the muscles around the eye, including orbicularis oculi. These buccal branches supply buccinator, orbicularis oris, and the muscles that move the upper lip. These marginal mandibular branches, which pass just below the body of the mandible, supply the muscles that move the lower lip. They also supply the platysma. In addition to supplying the muscles of facial expression, the facial nerve gives off this branch that supplies the posterior belly of the digastric and the stylohyoid muscle. Now that we've looked at the facial nerve, we'll look very briefly at the eighth cranial nerve, the vestibulocochlear. The vestibulocochlear nerve enters the internal auditory meatus, dividing as it does so into the vestibular and cochlear nerves. The vestibular nerve passes through this opening into the inner ear. The cochlear nerve passes through this one. The two nerves transmit our senses of balance and hearing, respectively. Let's move on to look at the last four cranial nerves. They're the glossopharyngeal, number 9, the vagus, number 10, the accessory, number 11, and the hypoglossal, number 12. These four nerves leave the skull close together. Here are the 9th, 10th, and 11th nerves. The 9th and 10th nerves arise from a line of filaments that emerge from the lateral aspect of the medulla. Here's the glossopharyngeal nerve, the 9th cranial nerve. It's quite small. Below it is the vagus, the 10th nerve, arising by one large root and a line of smaller ones that emerge from the medulla all the way down to here. Below the vagus is the accessory nerve. Its full name is the spinal accessory. It arises from a procession of filaments that emerge from the spinal cord from C1 as far down as C5. The spinal accessory runs upwards through the foramen magnum to join the 9th and 10th nerves. The hypoglossal nerve, the 12th cranial nerve, arises more anteriorly. Here are its filaments converging. The hypoglossal nerve passes through the dura by itself. The 9th, 10th and 11th nerves pass through the dura together to enter the jugular foramen. Nerves 9, 10 and 11 leave through this part of the jugular foramen. The hypoglossal nerve leaves through this opening, the hypoglossal canal. We'll go round to the outside of the skull to see where the nerves emerge. Here's the jugular foramen, with the hypoglossal canal opening just in front of it. Nerves 9, 10 and 11 emerge through this part of the jugular foramen. Here are the 4 nerves emerging in front of the upper end of the internal jugular vein. Here's the internal carotid artery. The styloid process was here. Here's the glossopharyngeal nerve. Here's the vagus. Here's the accessory. Here's the hypoglossal. To get to this view, we've removed the styloid process and its muscles, the posterior belly of the digastric muscle, and the ramus of the mandible, as we did in the last section. We'll follow these 4 nerves one at a time, adding or removing the overlying structures as we progress. The small glossopharyngeal nerve, this is it, is mainly a sensory nerve. It runs lateral to the internal carotid artery, then passes downward and forward through or lateral to the stylopharyngeus muscle, which it supplies. The glossopharyngeal nerve enters the wall of the pharynx here between the superior and middle constrictor muscles. The glossopharyngeal nerve provides sensation, including taste, to the posterior third of the tongue, and also sensation to the back of the oral cavity and the oropharynx. Now we'll move on to look at the vagus nerve. Its name means wandering. It goes all the way to the abdomen. The principal role of the vagus is to provide parasympathetic supply to organs throughout the thorax and upper abdomen. It also gives sensory and motor supply to the pharynx and larynx. To see the upper end of the vagus, we'll take this nerve, the hypoglossal, out of the picture for now. Here's the vagus. Its trunk is thickened by this ganglion, which is the lower of 2. To follow the vagus in its course down the neck, we'll move the internal jugular vein aside. The vagus runs down the neck with the internal jugular vein behind it and the internal and common carotid arteries in front of it, all the way down to the superior thoracic aperture. The clavicles have been removed in this dissection. Here's where they were. Here's the first rib. The vagus continues down into the thorax. Its further course is shown in tape 3 of this atlas. The vagus nerve has important branches in the neck. We'll remove the common and internal carotid arteries to see them. High in the neck, the vagus gives off a pharyngeal branch or branches, and this large branch, the superior laryngeal nerve. Right down in the thorax, the vagus also gives off the important recurrent laryngeal nerve. We'll come to it in a minute. The pharyngeal branch or branches of the vagus enter the wall of the pharynx. They supply the superior and middle constrictor muscles and all the muscles of the palate except the tensor palati. The superior laryngeal nerve passes downwards and forwards towards the hypopharynx. We'll follow the superior laryngeal nerve in another dissection. The hyoid bone is here. The thyroid cartilage is here. The superior laryngeal nerve, here it is, divides into an external branch and an internal branch. The internal branch enters the wall of the hypopharynx by passing through the thyrohyoid membrane here. It provides sensation to the hypopharynx, the epiglottis, and the part of the larynx that lies above the vocal folds. The external branch gives motor supply to the cricothyroid muscle and the inferior constrictor muscle. Now we look at the recurrent laryngeal nerve. To see it, we'll go to a different dissection in which the internal jugular vein, which was here, has been removed. Here's the common carotid artery. Here's the vagus. Down here, the vagus passes in front of the subclavian artery. As it does so, it gives off the recurrent laryngeal nerve. As we saw in tape 3, the recurrent laryngeal nerve goes round the subclavian artery on the right and round the arch of the aorta on the left. To see the recurrent laryngeal nerve in this dissection, we'll remove the common carotid artery. Here's the recurrent laryngeal nerve. It runs upwards and medially alongside the trachea and passes behind the lower pole of the thyroid gland. To follow its course, we'll remove the thyroid gland and the infrahyoid muscles. Here's the upper end of the trachea, joining the cricoid cartilage, which is here. This is the cricothyroid muscle. Here's the recurrent laryngeal nerve. It runs upwards and reaches the larynx here, behind the arch of the cricoid cartilage. In its upward course, it crosses the branches of the inferior thyroid artery, or runs between them, as in this case. The recurrent laryngeal nerve gives motor supply to all the muscles of the larynx, except the cricothyroid. It also provides sensation to the larynx below the vocal folds. Let's move on to look at the 11th cranial nerve, the accessory. It's a motor nerve, supplying just two muscles. The spinal accessory nerve passes around the upper end of the internal jugular vein, then passes downward and backward behind the posterior belly of the digastric. It runs beneath the sternocleidomastoid muscle, which will add to the picture. The spinal accessory supplies the sternocleidomastoid muscle, sometimes running deep to it, sometimes through it. Emerging near the posterior border of the sternocleidomastoid, the spinal accessory nerve runs downward and backward across the splenius muscle and passes beneath the other muscle that it supplies, the trapezius. Lastly, we'll look at the 12th cranial nerve, the hypoglossal. It's a motor nerve, supplying all the muscles of the tongue and partly supplying the infrahyoid muscles. The hypoglossal nerve emerges between the internal carotid artery and internal jugular vein. It runs downward and forward across the external carotid artery. We've added the styloglossus muscle to the picture here. Missing from the picture are the stylohyoid muscle and the posterior belly of the digastric. The hypoglossal nerve gives off this descending branch, then turns and runs forward. It runs just below the styloglossus muscle and passes forward into the gap between hyoglossus medially and the monohyoid muscle laterally, the same gap that the lingual nerve runs in. The hypoglossal nerve supplies all the muscles of the tongue, including the intrinsic muscles and also the geniohyoid muscle. To look at the descending branch of the hypoglossal nerve, we'll go further down the neck. Here's the descending branch of the hypoglossal nerve. Its fibers, in fact, come from C1. It passes downwards and forwards in front of the internal jugular vein. It's joined by this branch from C2 and 3 to form a loop called the ansa cervicalis. The branches that arise from the ansa cervicalis provide the motor supply to all four of the infrahyoid muscles. In looking at the 12 cranial nerves, we've concentrated on the main aspects of each nerve and omitted many of the smaller branches and cross-connections. We've also left out of the picture the complex autonomic nerve supply to the head and neck. The details of both the sympathetic and parasympathetic systems in the region are too small to be shown clearly in straightforward dissections. They're more readily understood from diagrams, to which I'm sure you'll have access. To end this section, we'll look at the one part of the autonomic system that is clearly visible, the sympathetic trunk. We'll also look briefly at the cervical nerves. To see the sympathetic trunk, we've removed all the cranial nerves and the internal jugular vein. We'll also move the common and internal carotid arteries aside. Here's the cervical sympathetic trunk. It runs up the neck on the fascia that lies in front of the longus muscles. This massive thickening at the top of the sympathetic trunk is the superior cervical ganglion. From its upper end, this nerve, the internal carotid nerve, arises and joins the internal carotid artery as it enters the carotid canal. Now we'll move on to look at the cervical plexus. To see it, we'll look at a dissection in which only the skin and subcutaneous tissue have been removed. Here's the cervical plexus. It's formed from the anterior roots of C1, 2, 3, and 4. These emerge in front of the middle scalene muscle. Most of the branches of the plexus run laterally. This one runs straight downwards. It's the phrenic nerve. The phrenic nerve runs downwards into the thorax on the front of the anterior scalene muscle to innervate the diaphragm. Many of the branches of the cervical plexus emerge here, around the posterior border of the sternocleidomastoid muscle. These are the supraclavicular nerves, which pass downward and laterally to supply the upper chest and shoulder region. This is the great auricular nerve, which supplies this area on the side of the face. This is the posterior auricular, which supplies this area. Here, just beneath the sternocleidomastoid, is the lesser occipital nerve. Here, more posteriorly, is the greater occipital nerve, arising from the posterior root of C2. The occipital nerves supply this area on the back of the scalp.